the old system that we had, you'd rip the stomach open and yank it off and sew the stomach back. Sometimes it will reoccur again.
Yep.
With the old system. Okay. Now, you claim that there's a new technology, which is why you're here. Can you tell me what that new technology, what it's all about?
Okay. The technology is all about that we have a non-invasive, not minimally invasive, non-invasive method.
Non-invasive means you don't cut.
No cutting at all. We don't even, on the day of treatment, we don't even touch the patient at all. The patient lies on the table. It's ridiculously simple. The patient lies on the table.
Yes.
We will have done all the pre-evaluation to be sure that she's right for the procedure.
Yes.
Once we're sure of that, she lies on the table. And it's just like what we're doing now. You set it on the computer. That is like a computer. You set it on the software. You will have localized where the fibroids are. And what you do is just be touching your mouse and fixing where you want to bond. Because what the machine does actually...
it bonds it?
It bonds it. It converts ultrasound to heat energy.
Wow.
And it's so focused. It's targeted.
Precise.
Very precise. It's only where you put it that it bonds.
Wow. So even if you have one that is big, you can burn it all off.
You can burn it all off, but sometimes, most of the time, we have many fibroids, not one.
Not one, yes, in different yes.
Yeah. If there's some, for example, you have about 10, 15, you probably might, and they're big, you might not be able to finish at one sitting because it will take you a long while. But because what we usually want to do is we don't want to spend more than 2-3 hours on one.
Yeah, the patient will even be tired.
Exactly. So we can say, okay, fine, we can, because it's non-ionizing radiation, so it's not X-ray. So it's not going to affect you in any way,
Would the patient be up and doing whilst all this is going on?
She's sedated, but not anesthetized. That means we want her to be able to talk to us. Actually, that's a very important aspect of the procedure.
Okay.
So she's sedated so that we reduce anxiety, but we don't anesthetize. And that's one of the upside of the procedure.
Oh, yes.
Because we don't even have many anesthetists. And one of the problems that we have with surgery, actually, when we do fibroid surgery, is anesthesia. So we take that out completely. We take out blood transfusion. We don't transfuse anybody because we don't cut you. And in 2 hours, you're good to go.
Wait, when you burn,
yeah,
what does it do? Pardon my ignorance. Does it melt?
It kills the fibroid, okay. It kills the fibroid and the blood supply. We do not remove the fibroid from the body.
Oh, so the fibroid still stays?
It stays there. But over time, the body now starts shrinking it. So what we expect in about 3 months is that it will have shrunken about 30-35%. In about 6 months, about 50%. In about 1 year, about 75%.
Is this any different from in some hospitals in Europe where all they do is cut the blood supply?
It's different because we don't touch you at all.